Hi, my name is Tim Smith, and I'm a board-certified anesthesiologist. I've been in practice here in Arizona since 1994. And some of you might be wondering, what is a board-certified anesthesiologist and how is that different than other types of anesthesia providers? Well, first of all, to become an anesthesiologist, you have to go to 4 years of medical school, and then you'll do 1 year of internship and then 3 years of residency. And then to become board certified, you then have to pass both a written and oral exam that shows that you have kind of received a degree in excellence, so that you're not just someone who has the basic knowledge, but you've actually exceeded all the knowledge that is out there for anesthesia. Like I said, I was in practice here since 1994, and I started working with Dr. Toll back then. In 1996, she approached me because she wanted to set up her own operating rooms that would allow her to provide more personalized care to her patients. The unique thing about what Dr. Toll approached me with is that she actually wanted to do things as safe as possible, irregardless of what the cost was, which is very unusual when somebody comes to me asking for help in setting up their office. Usually they want to try to cut costs as much as possible at the expense of safety. But Dr. Toll's primary interest was making sure that this was done in the safest environment possible. So I've been working with her at her office and also at Scottsdale Abrazo Hospital now for over 20 years, and I provide anesthesia care. She provides the dental care to a wide range of patients. These are patients that could be just dental phobics. They haven't been to the dentist for 10, 20 years for whatever reason, and they have a multiple amount of dental problems that require extensive work, all the way to patients that have very extensive medical histories that aren't able to be done in the traditional dental office. So she provides a very niche care for these types of patients, which I think is great for these types of patients, because when they come to this office, this office is geared towards treating those types of patients. And so they're used to taking care of patients with different concerns, different medical problems, and they are capable of taking care of all those types of needs. So at Dr. Toll's office, you can actually have multiple types of anesthesia, ranging from oral sedation to kind of IV sedation, sometimes referred to as twilight anesthesia, all the way to general anesthesia. Now for the oral sedation, that's not something that Dr. Toll has an anesthesiologist there. She usually has a nurse who's trained in that specific type of administration of medications, and that's kind of a light sedation for those patients that just need light sedation. And then for some patients, maybe that's just a real quick procedure that might not require real deep anesthesia. Sometimes we do IV sedation, and that's a little bit deeper sedation, makes patients, they get some medication through their IV, and they are monitored with EKG, blood pressure, pulse oximetry, all that types of monitoring to make sure that they are treated safely, all the way up to a general anesthetic, and that's primarily what she would have a board-certified anesthesiologist there for. And that's where she's going to be doing extensive work for an extended period of time, and that's where you are completely unconscious and completely unaware of what's going on. And there's multiple ways that we can administer that anesthesia. Most commonly, it's done by starting an IV preoperatively, giving you a sedative prior to getting into the dental room, and then giving you stronger medication through the IV that will drift you completely off to sleep. And then we have you breathe in some anesthetic gases afterwards that keep you asleep for the duration of the procedure. Now, some of Dr. Toll's patients are such phobics that they don't even don't like needles. They don't want needles anywhere close to them. And so for those patients, we offer a different type of anesthetic where we can actually bring you into the operating, or to the dental room, I should say, and have you breathe in anesthetic gases and drift off to sleep that way. And then we can start your IV after your sleep. So there's multiple ways that we're able to do the anesthesia and do it safely and do it comfortably for the patient as well.